So clinic's all closed. This is for the internship class. I'm just showing you what I do on a day-to-day basis for my job to hopefully become a physical therapist one day. I'm currently an aide at Beach City Orthopedics. Everything's in reverse right now, but I'm just gonna walk you through the clinic, give you a quick tour, and I'll show you what's going on. So typically when I walk into the front entrance here, kind of go over here to the computers, clock in, check what's going on in the charts, and then usually by the time I get here, we already have some patients, maybe 2 in 1 hour, kind of work hand in hand with the PT, let them delegate what we're going to be giving therapeutic exercise to the patient or modalities. And speaking of modalities, one of the first things we use here, NMES. So let me try to get this open for you real quick. So for neuromuscular re-education, someone, for example, doesn't know how to fire their quad that well, rotator cuff, typically in the post-op, we'll get some electrodes, get them going on that to pair alongside their exercises. But it gets getting a little bit ahead of it. Let's say for the typical population, for follow-ups especially, we got these setups, cardio machines, usually to warm up before we get the session started for any exercises or stretches. So cardio there. We also got treadmill right there. And this is kind of like the overview of the clinic that I work at. Cool. And here's all of our equipment that we work with here. This is typically our band and lower weight rack that we use to give for the patients. Here's a stretch rack. And this is a pretty popular spot because we can anchor our bands here. Anything not just for stretching, obviously, especially when it gets pretty packed around here. And we have several different types of resistances that we will give to our patients. So as you can see here, we have some plates for a little bit of the athletic population, or if you get pretty strong in their journey, we'll start to load you a little bit more. But here's typically where we start loading patients with some resistance, especially for the shoulder patients. It's pretty typical in this corner right here to anchor on, for example. So let's say if you want to get a rotator cuff exercise, we would use these TheraBands, kind of hook it up to here. We could do some external rotation, internal rotation. Sometimes for core, we can use a Palloff press. That can be it for balance too. We try to be versatile with every piece of equipment here because, we could have 10 shoulders from 5 different PTs going on at once, and we kind of got to improvise while that's going on. So those are kind of the general things. And let's see what else we got here. Another modality that we like to use a lot here, especially for patients that are in a lot of pain. Heat packs, super simple. Just in this microwave for about 1.5 minutes, maybe more on each side. Kind of get a layer of sheets right there. And that's one way to kind of warm up a patient as well. So typically if they're able to, get the joints moving because that's the best way to get the warm up in. If not, start them off on some heat to get the joints a little bit looser. Cool. And just a little overview of some of the gear from outside. Since we're closed, I already put everything inside. We have a sled that we typically push outside on the turf. We do have a turf outside and a little trampoline. So a little overview for the turf out here. Partially use it for the sled, but also for testing, especially for athletes or any return to sport clientele, to kind of test out how their progress is going, if they are ready to go back to play. So, and speaking of another testing thing, so this doesn't just relate to athletes. Right now what I have in mind is particularly for quad strength. I'm trying to look for the little tin deck right now, but we do a little quad test. Here it is. This little guy right here. And we would hook that up to a little anchor such as our little hamstring curl machine right here. And we would set a degree with a goniometer of 60 degrees is the typical one. And then they kind of fight against this and give it all they got for a few until it shows how many pounds of force they're putting into this little tin deck device. And typically they'll compare and contrast with the healthy side and then generate a percentage, and that's how they see where they're at in their journey. So we'll take one in the beginning where typically the percentage would be quite high in difference, and then the goal is obviously to get it as close to 100% or close to each other, and that will dictate either their return to sport or their health, their progress, right? How they're doing. So, and that's pretty much the overview of the clinic as a whole. And I wanted to show a different modality that we like to use quite a bit. And this isn't specific for a typical demographic, but we use it for a particular one, sorry. But BFR, we have BFR here. So from post-op to athletes, or if we're just trying to have a recovery day but we still want to get some work going, we have BFR machines, and it's a tourniquet system that induces hypertrophy with lesser impact. So basically it lessens the amount of oxygen that blood and oxygen that flows to a certain limb. It's typically used here in legs, but of course arms are available. And exercise is induced as well in hypertrophy rep sets. So the sets are 30 or 4 sets. First set's 30, 15, 15, and 15, 75 reps total. And usually that burns pretty hard. So the purpose of that is to still get hypertrophy and work going without the impact of heavier load. For example, you can make 2 pounds of an ankle weight feel like a ton more, but it's not going to be heavily impactful on the joint, but we'll still get some useful muscle work done. So again, if the post-op is a few weeks in, or just a few weeks out of the surgery, it'd be pretty useful to use it on that. So the joint doesn't get stretched or stressed, or any ligaments get stressed, but the muscle still gets work going. Plus it's pretty good for recovery. And going back to recovery, we also have some boots here too. So at the end of the session, we have some Normatec boots to kind of get some fluids moving around in the legs. And if someone's just had a hard day, we'll kind of go a little bit lighter in the session, and then we'll put these on those bad boys. So Hyperice has arms, and I think they have hips, but we only have the leg boots here. And the most common recovery tool we use here, super high tech. We're gonna go back here to our break room. Either the ice machine, if we want to make ice packs to go, or the good old ice gel packs. If they had a pretty good session, or their doctor requires them to be icing quite a bit to help with swelling or just manage their pain, that's something that we can be giving as well. And up here, actually in the break room, this is where all our supplies are. Typically manage these and make sure the clinic is just well stocked with everything we need. And this is also where we kind of eat and just kind of, take a step away from everything. And just for fun, I'm not going to show you any, but a lot of the chart work is done here in front of the front desk to just get us set up for the next day and what we're going to do. So yeah, this is what I do for being an aide at Beachy Orthopedics.